Today's date is July 14th, 2016. We're here with Rihanna, and you can hear her baby in the background. Rihanna came to us from Kingman, Arizona, and you saw some videos. And
I did. My husband saw some videos online. Yes.
right, Rihanna has very significant rheumatoid arthritis, and it should be obvious on when I show you her hands. She cannot straighten out this finger. If you look at her wrist, you can see gross swelling in her wrists. If she tries to straighten her arm, it's tough, and you can see deformity in there in her arm too. And if I ask her to get her hands over her head, your arms, can you?
Barely. It's painful.
Okay. And you have knee problems and ankle problems. And the reason why I'm making this video is you've only had this condition for 4 to 5 years,
Correct.
right?
5 years.
But you noticed something around the time your son was born, which was 7 years ago. So you noticed some symptoms then, right?
Yes. Carpal tunnel-like symptoms.
Carpal tunnel, okay. And in my history of you, we went back further and we found that you had some root canals, right?
Correct.
And they were done even before your son was born. They were done about 10 years ago.
Yes.
So they antedated all of this, and you also had your wisdom teeth removed.
Correct.
What happened when I had you touch your root canals and I muscle tested you?
I could barely move my arm. Oh, well, you moved
could
my arm.
barely-
I couldn't fight you. I couldn't fight you. I couldn't
you
fight
had no
back.
strength.
I had no strength, exactly.
You collapsed.
Right. Correct.
And then, as a test dose of neural therapy, we injected those teeth. What happened when we injected them?
My joints felt better. I could walk a little easier. My knees felt a lot better.
Your
And
knees
my
felt a
fingers
lot
too.
better? And
Yeah.
your fingers. I think
Correct.
you said even 60 to 70% less pain. Is that right?
Yeah. 'Cause
That
when
was
I-
immediate.
Yes.
Did I tell you that was going to happen?
No.
No. Okay. That's a good sign, actually. I'm not happy that your teeth are involved, but actually, if it's the cause, that's good
Right.
because it's remedial. So we're going to send you to a dentist. We're going to get that x-rayed and see if we can confirm a diagnosis of cavitations or infection in your jaw. You okay with that?
I am, absolutely.
And may I post this on YouTube?
Yes, you can.
Thanks. I don't know if I'm going to have a follow-up of you because you're from Kingman, Arizona.
Right.
But I'll talk to you on the phone and hopefully get you treated in Flagstaff.
That'd be great.
Okay? Thank you.
Thank you.
Now, you also told me something after I found the problem with your teeth, right?
Yes,
You
correct.
told me, what did they find in that tooth?
I had an abscess swelling. It was an infection in this tooth. This bottom one. The first root canal that they did was on that tooth, actually, because
The back tooth.
actually the front one.
The front one.
The
That would be
front.
tooth number 30.
Yeah.
So you had an abscess, and you told me they found something weird in there?
Yes, they found some kind of tissue paper from the last dentist who had worked on the tooth. So, yeah, and the guy who did the root canal pulled it out, and he didn't know what it was. It was like yellow paper that had been put in my tooth, causing the infection probably.
So now we know you had an abscess, foreign body left in there.
Yes.
You still have root canals. The chances of you having infection are extraordinarily high. And in my opinion, that could be seeding your body
Yeah.
with germs that could settle in your joints. I encourage the viewer to go to the great work of Weston Price, Weston, last name Price, of the last century. He was one of the greatest researchers of all time and a dentist. And they could go to the Price Pottinger Foundation for his works. And he found that root canals can, if they take a root canal out of you and they put it in an animal, that animal can get exactly the disease you have.
Wow.
Isn't that
That's
interesting?
amazing.
And dentists to this day don't know that.
Wow.
Thanks.
Thank you.
Well, we're back with Rihanna after she just had an ozone 10 pass, and she wanted to tell the viewer what's happened to her. You're moving your arms much. I can't believe what I'm seeing with
Yeah,
your
no,
movement right now.
I feel really good. I came in really super tense, and now Well, look, I can do that. So I feel really, there's a significant difference for sure. Because earlier I was like going like this, and now I can, pretty easy. So I feel great.
I wanted the viewer to see that, because when you came in here,
Yeah.
put your arms up. You know, you could only get your
Yeah,
arms
I could
up
get like this. Yeah.
like that with great effort.
Right.
Go up to the top now.
Yeah, I feel way better. No,
I'm
I feel
blown
good.
away. I am. I
Good.
really am. You know, once in a while, I'm not blown away by ozone.
Right,
But
right.
once in a while, somebody comes in here with this type of thing that
Right.
that really knocks me down.
Yeah, no,
in a
I feel
positive way.
a big difference.
Let me see you get up and go to the door. You got right up
Yeah.
without any difficulty.
Yeah, no.
How does your brain feel?
I'm tired, but but I feel good. I feel good. I'm glad that.
Okay, you're tired.
Yeah.
But does your body feel like it has more energy?
Yes,
perchance?
absolutely. Yeah, no, definitely. I feel
Okay.
energized.
Is this something you would recommend to others?
Oh, absolutely. Yeah, of course.
Okay. Again, for the viewer, you're going to see a dentist. We're going to check on potentially infected teeth that could be poisoning your body
Right.
as a cause. You had an ozone 10 pass today, and in my opinion, that supports the possibility of infection.
Right.
And the ozone would be detoxing you as well,
Okay.
and reducing inflammation. So I'm really delighted with what happened to you today.
Me too.
And I may post this.
Go ahead, for
Thank
sure.
Okay, we're here with Brian. You're the husband of Rihanna, right?
Yes, sir.
And you've had to live with her developing this terrible disease, rheumatoid arthritis, over several years, right?
Yes, sir.
This was your first visit today. What did you notice this afternoon in what happened to her?
Well, I noticed that
Louder.
she was able to raise her hand above her head, and typically she experiences a tremendous amount of pain when she does that. And so today was quite an eye-opener, I'll say, to see her lifting her hands both above her head like nothing.
Like nothing. It was just spontaneous.
Yes.
She got her hands up just like that.
Exactly.
And I told her I was shocked. In fact, my jaw dropped. So you also saw her walking better too, probably, did you not?
Yes, typically she walks with a bit of a limp,
Yeah.
or I'm not sure how to describe it, but it's
I hope this gives you a lot of hope.
does.
Good.
Absolutely.
We'll see how things go in the coming days, weeks, and months. All right.
Yes.
Thank you. And
Thank you.
on Saturday I won't be able to video you guys because you're in Kingman, but we'll be in touch, right?
Yes, sir.
Thanks.
Thank you.
I may post you.
Yes, you may.